Sure. You're planning to do
So here we have this patient who was operated case of oral cancer. He had his maxillary resection done. It's a post maxillectomy. Also, he has undergone chemo and radiotherapy as well. Now he has come for the secondary reconstruction. We're going to give fullness in the upper lip, trying to give him a good cheek contour. Also, we are addressing his temporal hollowness. We are going to place implant here so that he will have a good facial balance. So all of this procedure we are trying to do from the hemicoronal approach so that we can give implant in the temporal hollowness region. So we'll be shifting the patient to the operation theater now. Thank you.
This is the post-oncologic resection deformity that you're seeing. We're going to be working on the patient's calvarium, temporal bone, mandible, lower jaw, upper jaw. We're going to be trying to improve this as much as we can. This is immediately after we have given anesthesia and before we started. Look at the hollowing as well, about the ear. And we're going to address that as well.
Hello everyone, so we have done post-onco facial rehabilitation for him, and we have done right side of this peak augmentation, and we have took nasolabial flaps, and we have constructed the maxillary vestibule as maxilla is removed, and we have done this lower subapical osteotomy also. So we have done this facial reconstruction for him, and he has a bit of swelling which is going to reduce gradually. And how are you doing? This is his first day after his surgery. How are you doing? So what do you say? How are you doing? Good? Okay. You drank anything? Drank? Okay. Cool. Yeah. Okay, we'll follow you up his progress every day. Thank you.
So it's now 4 days following his surgery. We have done his temporal bone reconstruction. We have also raised nasolabial flap to create a vestibule. He had a cancer surgery of the maxilla. So his anterior maxilla has been removed. We have tried to create a vestibule with the help of these flaps. Also, we have done a surgery in his lower jaw, that's called lower subapical osteotomy, so that the lower jaw, which is forward, is gonna come back. So it's way better than how it was before. And this is 4 days. Tomorrow, all of these plasters, pressure dressings, everything will come out, and we'll come back again tomorrow and show you how it's gonna perform tomorrow. Thank you.
Everyone, so this is his 5th day after his surgery. We have done facial rehabilitation, and we have done maxillary vestibule reconstruction and peak temporal augmentation. So as you can see, there is a bit of swelling which is going to reduce. And how are you feeling? How are you feeling? Good? Okay. You drank anything? Liquid diet? Liquids? Any liquids? Juice, huh? Okay. You're good. Okay.